And you all can feel free to mute yourselves. And this is really going to be a conversation between all of us. So um, I am going to monitor the chat as best I can. But feel free to unmute yourselves. This is a big old conversation. If you all would please just, if you can, you unmute yourself. But if you're driving or doing other things, don't worry about it. I see Barbara's here, Gail is here. Hello, Barbara. Hello, Gail. Hello, Kimberly. Hello, Pat. We will go ahead and get started and dive right into the content in just a moment. Let me give everyone about 1 more minute to hop on, and we will get started. And I am going to log in from my phone as well so that I can see any comments. So if you see me twice, that's what's going on here. All right, we'll go ahead and get started. So thank you all for joining me today. I am super excited about this particular webinar because I felt like this is something that hasn't been done before. Maybe it has, I just hadn't heard about it. But I really wanted to dive in and talk about maternal health and digital media, social media, all of that good stuff, right? The whole ecosystem all together. So we are here to learn about social media as well as how we can better utilize it to reach constituents as well as healthcare providers. So logging on in, we're just going to dive right into the content here. So before we begin, this webinar will be recorded. Submit your questions anytime. We'll do a Q&A at the end, and I will send you guys a survey so you can let me know if there's anything else you want to know about that I did not cover here, if you'd like me to go into more of a description of some things. I'm going to go really fast because I want to leave as much time as we can for questions so that I can answer all of your questions and give you as much help as I can on this webinar. This is very interactive, so if you want, feel free to hop on via video or unmute yourself and ask a question. Stop me anywhere in between this webinar, and we'll go ahead and dive in here. So today what we'll be going over is how to navigate social media and make it work for you, how to engage on each social media platform to build key relationships beyond the post. We're going to talk a little bit about HIPAA. I'm not going to spend too much time there. I am just going to lightly touch on HIPAA compliance. And then the bonus, where we'll be spending the bulk of our time, is really talking about how to talk to Black mothers and cultivating relationships both online and offline. And if you need help with that, I'll kind of disclose a little bit and talk to you guys a little bit about how we can work together, how I can help you in this mission of mine that I've been given, utilizing social media to reach more mothers as well as healthcare providers, and providing you all with the resources to do so. So my name is Jessica, and you guys all know that because you registered, right? My name's all over it. I began my journey after the birth of my son. So he was number four, and he's here now, older. And I am the founder of Woke Delivery. Woke Delivery is really about utilizing social media and digital media to deliver woke care, as I call it. So I created a framework around woke care and delivering that via digital and ways in which you can do so. So it really is a model on how to do so. So I've been featured in all of the news outlets that you see here. I am part of the Sacramento Maternal Mental Health Collaborative. Oh my goodness, say that fast 3 times, right? Fox 40 has interviewed me. I've been on NPR, PSI speaker, Stop Stigma Sacramento, all of that good stuff, right? I'm a mom of 6. I am a wife, an advocate, and I have never met a cookie that I didn't like. I love cookies. And 90s hip hop and R&B, before Jennifer Lopez was the big thing, I was gonna be her. I was gonna be a flight girl. I had my mind set on it, but God had other plans for me. So here we are today. So moving on into my timeline and the journey. So I went through postpartum depression for years before I realized I actually had postpartum depression. I was diagnosed, And at the time the doctor told me, I was like, yeah, no, I'm not. You don't know what you're talking about. There's no way. Black people don't get depressed. Nah, not over here. So with that being said, went through a little bit of self-stigma, right? And how do you know if you're depressed when you live in an environment when everyone's depressed around you, right? What do you know? How do you know what that looks like when everyone around you actually is going through it? So at that time, the picture here that you see here is really me deep in the throes of it with my fourth child. In 2014, I started working with Stop Stigma Sacramento. I started a nonprofit organization supporting mothers and really getting out there and trying to bring as many mothers as I could to my support group. I found that didn't work. I didn't get very much attendance. So with that, I wanted to find a way to reach mothers and I started doing YouTube videos, and I started just really getting out there and speaking. And I found that to be very useful, speaking as well as YouTube and interviewing other moms who had gone through the same thing. I started doing advocacy with 2020 Mom, and really truthfully, I left maternal mental health. I had gone out to help experts know what to do with social media. So I was helping speakers, I was helping healthcare professionals who wanted to build a personal brand. Who else did I have? I was helping pastors' wives, like anyone that had expertise. I helped them build a digital brand. And so I left maternal mental health. And what brought me back to maternal mental health, it's not a 2020 Mom, but a thank you. I recorded all these videos on YouTube, and someone just left a simple thank you in a comment section on one of my videos. I got the alert, and I was, oh my God, people are actually watching this. So with that, I ran into a community of mothers who were really in the comments supporting each other. And I said, okay, well, why aren't our healthcare providers here? Why aren't we, reaching out? Of course, there's certain things with HIPAA that you can't do. However, there are ways to at least just give them information and the resources, because a lot of women were just saying, I don't know what to do. I don't know where to turn, and I don't know who to talk to. So within that, I want to just give this precursor to you all. The biggest compliment you can get is a comment. The biggest compliment is a comment. So if you have mothers leaving comments, or healthcare providers, or anyone that you're looking to help with your social media posts, if they're leaving comments, then you have to respect and return the favor, right? If they're leaving a comment, then just respond to them. Make sure they know that you're aware of them. So I was instrumental in the AB 2193 getting into action. Let me just say that I was the only African-American woman, really African-American period, on the California Task Force on the Status of Maternal Health with 2020 Mom. So I was the one mother raising her hand going, hey, no, mothers need this, mothers need that, kind of causing havoc. And a lot of people were looking at me like, who are you? Where did you come from? Very much intimidated. However, I knew that this was super duper important because I had gone through it myself. So super excited about AB 2193, super excited about the work that we've done with 2020 Mom, the work that I've done, just solo, and I just can't believe that, my life is being used in this way, especially where I come from. So let's now move to where I come from. So I lost my brother due to gun violence in 2004, right before I gave birth to my son, or I found out I was pregnant with my son, I should say. Our house was shut up, and this is the house down here at the bottom. As you can see, the paint is peeling and all that good stuff. This is a 2-bedroom home, and we had 10 people, up to 12 people at one point that lived in this home with us. So going through all of that, losing my brother at an early age, and I was his healthcare provider. I was his mom, really, his second mom. My mother worked 3 jobs. She was never home usually when we were younger. So as I got older, I kind of became the head individual, the leader of the pack, if you will. As I had more children, of course, I got to a point in my life where it's like, I don't know what I'm supposed to do. What am I supposed to do? I need to get my kids out of this environment. This isn't healthy. They now, a lot of them do still deal with nightmares, as well as myself, right? I deal with, of course, postpartum depression, and it's an everyday battle. So from that, I figured out what to do. number one, get out of there. So I moved to Sacramento, and we've been here ever since. And so I wanted to help you all kind of figure out what you needed to do in social media, right? And this is why this webinar is here. So that is one slide I forgot to take out of there. But now we're looking at raising aces. So I realized the impact that all of the traumatic experiences that I had gone through would impact my children. And so in knowing what to do next, I decided to make this jump and this leap to pack up my kids, move far away from anyone, you know, my mom, support systems, all that good stuff, and just do it on my own between myself and my husband. And coming to this realization that anything that I go through ultimately can be transferred to my kids and their environment, all that good stuff. This is really important, but we also need to bring this awareness to mothers who may not know about this. So how do we utilize digital media to do so, to let them know that what's happening to you is not only happening to you. You know, my dear, it's not only happening to you. What you're going through will also translate down to your kids, and it'll affect your children as well. And their livelihood, right? How long they live will be affected upon whether or not we can help you live a better life, right? So I say all of that to say, why digital, why now? Of course, because of the, you know, raising aces, but also social media platforms are used by mothers, right? In a survey conducted by Edison Research, it was found that the average US mother spends approximately 3.5 hours, and I think this is even incorrect, using the internet per day. Because if you have an Apple iPhone, it'll tell you how long you spend on social media. And I kid you not, there have been times when it's been 8 hours, 10 hours on here. So I don't even think I think that they've probably underestimated that. However, due to its probability and ease, 90% of mothers have a mobile device, and that's 90% of mothers, right? 93% of mothers are using social media sites. I mean, that's basically everyone. All of our mothers are here. So I wanted to put together this particular webinar to show you all how you can better utilize the resources that we have here at our fingertips to help mothers. So I wanted you to know what to do. Like I said before, I was stuck in a situation in an environment you know, that was unhealthy, that was unsafe, and I didn't know what to do. I just knew I needed to get out of there, but I want you all to know what to do with social media and how to reach mothers. So social media is super duper easy. I don't know if you all have heard it explained in this way, but social media is a conversation. You're either starting a conversation, jumping into a conversation that's already happening, or finishing up a conversation that you started in person. That's all it is. It's one big conversation. So with that being said, I don't want to go empowerment. Let's look at how we navigate social media. Well, actually, I'm going to go into this, social media explained. So I'm skipping ahead a little bit, but I'll go back to those other slides. Social media explained is super easy, right? Instagram is a club. These are just simple layman's terms to explain all of it. Instagram is really a party place. Pictures are there, and they're individual clubs. So each page is a club. So you have my page is all about digital media. You might go to another page that's all about motivation. They're all individual clubs. Usually you're coming there for entertainment, for education, for information. Once again, or maybe I didn't say it before, but I tell my clients all the time, people are coming to the internet for one of three things: information, education, or entertainment. And if you can do all three, you can hold an audience, you can engage. So Instagram is your party place, it's your club. And as you can see, this is the oldest DJ in, I think she's the oldest DJ in the world. Anyway, I just thought that was really cute and fun. Facebook is all about neighborhoods. So you see Mr. Rogers here. Facebook is all about your neighborhoods. Each individual profile is a neighborhood, and of course the business pages are businesses. And the way that we talk and communicate on Facebook is really about friendships, family, and community. So when you speak that language that you speak on a particular platform, you have to speak in their language, right? You have to talk to them as though they're family, your community, so on and so forth. Twitter is a newsroom. Twitter is where all the news is happening, the up-to-date, what's happening right now, what's trending. It is a newsroom. So you have different topics that are going on at one time, and how you follow those topics are by utilizing hashtags. Within those hashtags, you are able to find the content that you want to find in that newsroom. I hope that makes sense. Pinterest is a library. Pinterest is the library of libraries. You go there to find a specific topic or niche of things that someone is talking about, and then you're linked directly to that website that talks about that thing. So I hope I explained that correctly, but that's pretty much what it is. It's kind of like finding, different book sections, right? You have this section on business, this section on healthcare, this section of business, and that is what Pinterest is. It really is a big digital library. And LinkedIn is a business complex. LinkedIn is each individual profile is a business, and those little offices are inside the big hub of LinkedIn. So I hope this explains it a little bit easier so you're able to really break down what content you should share on what platform or how you should best utilize each platform. But I really wanted to follow up with that. So now I'll go back to, let's talk empowerment. So actually, I'm gonna start here. How to navigate social media and make it work for you. Now that we've kind of gone over each particular platform, navigating social media and making it work for you, you have to understand how you're going to, or what type of content you're going to put out. So social networking is your Facebook, your LinkedIn. I'm going to say that no one's on Google Plus anymore. I don't know, but I'm going to guess that no one's on Google Plus anymore. Photo sharing. We're talking about, Instagram, Snapchat, Pinterest. Those are all your photo sharing platforms. Microblogging, Twitter, Tumblr, Medium, and Instagram. Those are all your microblogging. I know when you think of Instagram, you only think of pictures, but on Instagram, you're actually microblogging because the content that you put in your captions needs to tell a story about the picture. I hope that makes sense, but you guys feel free, like I said, jump in and ask me questions at any time. And then video sharing, YouTube, Facebook Live, Periscope, IGTV, Vimeo, those are all of your video sharing platforms, and you're gonna have multiple ways of sharing your content on those platforms. So now we can move into empowerment. Each one of you, all of your companies should all have a community rep. Your community rep should talk to you about what's happening in the community that you serve. You should empower your mothers to have their voice heard by you all. So if you don't have a community rep, you should find a community rep in your area that can tell you what's going on in your community. And I'll talk a little bit about that as we move forward. Culture. You should know music, popular blogs, the news. You should know a lot of the information that's going on. What's a really simple tool that you can use is Google Trends, as well as Google Alerts. So if you utilize Google Trends and Google Alerts, you can actually get alerts when things are happening in the maternal health world for your specific county, so on and so forth. And this is just a cute little GIF. Let me see if it'll play. This is a GIF that a young gal made, but conversation. So you should be interacting. You should have if you don't have a podcast, you can have like webinar series, YouTube channel series, some type of way that you can keep the conversation going and the information is just readily available for your mothers to consume on their own time, right? Digital media is all about being able to consume on-demand content. So really truthfully, you're creating all of this content and you're putting it down in one place so that they're able to go in and grab what they need when they need it. So we talked a little bit about that. We explained that. Now, defining your content. There's so many different ways that you can grab content. You do not have to create it all yourself. You can use user-generated content, which is, gathering stories, interviews, having your community rep or your community mom come in and gather, that information. Educational content, which is your how-to, your explorer videos, your interviews, and knowing your top three. Your top three are the top 3 topics that you talk about on your page all the time. Your top 3 should be the central hub of where all of your content spews from. Your events should be catered around your top 3, your webinars, your services, they really tie into each other. And you should really define what your top 3 are. And so now we're going to move in how to engage. Like I said, I'm going to go really fast, so I apologize in advance if I'm talking way too fast. best, but you will get the recording on this, and feel free to ask me any questions at the end as well. So how to engage on social media on each platform to build a key relationship. We talked a little bit about this already, but understanding your audience's needs is the biggest point I can give to you. So ask them in IG stories, create a post that asks them, hey, what would you like to know? What are you struggling with right now? Survey your audience. On your website, you should have a little pop-up, or if you don't like pop-ups, some people don't like pop-ups. Or you should have a way for people to come in and give their advice, right? And share. What do they want to be an expert on? Making the mother the expert is the biggest key I can give you. And then, of course, emailing and asking what they would like to hear about, what content they would like to see. So when we think about engagement, we're thinking about posting with a purpose. So here we have Maslow's hierarchy of needs. I love this particular model of this, and I just found it on the internet, so I don't know where it came from, all that good stuff. It didn't link back to the actual source. But when we look at Maslow's hierarchy of needs, it really is our social media hierarchy of needs, right? And I love the way that this breaks it down, right? Your device is kind of like your psychological needs, your safety is keeping you safe away from strangers and things that affect on social media. But then your love and belonging is really truthfully in your self-esteem. That really encompasses social media and all, and why mothers are going to it and what their attraction is to it. They want to belong to something. They want to feel respected and valued. They want high interconnect, like it says here, with posted likes. They want all of that good stuff, right? And I know for myself, I had to Google how to heal. I had to Google it. I had to Google what I should do, because I didn't feel, I won't say safe, but I felt as though my kids were going to be taken away if I said anything about it, or if I said I had it. So the internet became my best friend. The internet and researching and commenting and asking, other community members and going into Facebook groups and things like that, that became my center in the way that I learned how to heal. So really think about, when we think about creating a post, we want to think about which need we are speaking to. So the different types of posts, you have educational posts, you have happy posts, you have sales posts, show some love. This is really broken down a bit more in a posting guide that I have, but this is just a general overall, and I think most of you probably already know most of this. So the objective, right? When you post with a purpose, you're going to look at the objective, and I like to think of it as an event, right? We have an event that we're going to, and that's where we're going. That's where we want to hit them, where we want to hit them emotionally, right? And then we have the content, which is how you dress it up. What are you going to wear, right? How you dress it up. So I always think of my post as women. So sorry guys, and you guys might see this, but I always think of women. Women are going to an event, right? We want that post to do a certain thing. Now, what do they need to look like? What do they need to say? In what way does it need to be put on the different platforms? As we talked about before, all of the different platforms have a different way of communication, right? Instagram's going to be a little bit more fun, a little bit more hangout-ish. Facebook's going to be definitely more neighborhood friendly. Twitter's going to be more newsroom. Pinterest will be more linking back. So those different types of communication styles, right? How she's going to dress and how she's going to appear depends on where she's going. All right, and then the engagement, the conversation, what does she need to say, right? So on some of these particular platforms, you're going to use, you're not always going to be grammarly correct. You might use a hey girl or a, how do you feel about that? Something to that effect, right? You're going to use just words that are going to connect with that audience on that particular platform, right? So that is the objective, the content, and the engagement. So now moving into social media has made us all media companies. So if you thought that you were just a maternal health training company, or I'm not sure where everyone is from or what occupation you're in, if you could go into the chat and let me know where you, I don't want to know where you work. I want to know what you do. How about that? So if you can go into the chat and just post what you do, I am going to finally log in here. And if you could just let me know what you all do and where you work in the maternal health space, that would be great. So I can kind of cater this a little bit more. Therapist and outreach with PD, okay. Community nursing, health nursing, okay. Okay, so yeah, I think that works for me. So if you thought that you were just a therapist and you were just utilizing social media has just changed us into media companies, right? So we are a media platform now. We have to utilize media in a way of which, I don't have that slide up here, but I'm going to, let me see what I have on my, we all are TV networks, basically. And depending on what type of television network we want to be is how we're going to communicate our information. So let's say, for instance, we think about a network like NBC. We know a lot of that content is probably going to be more funny on the story side, all that good stuff. When we think about NPR, for instance, we know that that's going to be all audio and podcast. When we think about Lifetime, we know all of the content there will be stories. So you really have to start to look at the platforms and your posts and think about them as your content mediums and your episodes. So if you think about your content as your episodes, then it'll help you cater your post and know exactly what you're posting when. So I hope that kind of breaks it down a little bit. I put some of my posts here. I know for sure that my network is all about, well, this particular one, because I have several. And to that effect, to that point, you may need to have 2 or 3 pages to reach specific audiences. So an audience that is in maternal health, advocacy, training, stigma reduction, that's focus on development and fundraising. Okay, so yeah, media company, right? You have to put out information so that people are aware, especially when we're doing fundraising. When we want to fundraise, we have to make people aware of the information that we're putting out. We have to have all of our data points and the amount of people that we've helped, you know, all that good stuff, right? So we want to make sure that the content that we're pulling together as a network, we're all networks. That's pretty much what we are. And the content that we put out are episodes that drive back to our networks. So really defining, like I said before, your top 3 will help you define the post that you should put out to your community, because they're going to look for that. And like I said, to that point, you may need to have 2 or 3 separate pages. So for instance, I work with experts who are speakers, who want to build a personal brand, but then I also have the maternal health side of things digitally, right? So I have to have 2 separate pages for 2 separate entities. They intertwine a little bit. However, you guys don't want to know about brand building as an individual. You want to know about social media and how to use digital media to inform moms, to inform healthcare providers, all that good stuff. Going back to AB, which I skipped over, or I talked about a little bit. Going back to AB 2193, all of the healthcare providers now have to be trained. They have to know what to look for. They have to know, you know, so when we think about how we're going to place our content out there, we have to keep that in focus and understand that our specific audience on each page, they're coming to us for a thing, right? And we have to define that thing. So I hope that makes sense, and I hope I gave you that information correctly. I hope you can understand that. So the platform is just as important as the post. Depending upon how you're going to deliver the content, depends upon which platform you're going to use to deliver that content, right? The platform is just as important as the post. So social media management tools, this is where that comes in. If you have 2 or 3 different pages you have to manage, you definitely need a social media management tool. And so Buffer, Hootsuite, and as a social media manager myself, I know the struggle. It is difficult to manage a social media management. But there is a better way to do things. Utilizing Buffer, Hootsuite, those are the ones that I prefer, but there are a gazillion of them out there. And then also on the platform itself, Facebook actually has a way where you can schedule your posts several weeks. I believe you can schedule up to 2 months in advance. So you can schedule out your posts and not have to touch it again. You know, sit down, do it one time for an hour and a half, get all your content together, get it all scheduled, and you're out, right? So tools. This is a big list, and I'll have an equipment ebook, if you want that equipment ebook, go ahead and contact me after this. It is not quite done. I just decided to put it together, like, no kidding, 2 days ago, because people have been asking me about it. But the equipment ebook will give you the podcasting platforms, the microphones you should use, the video cameras you should use, all that good stuff, the ones that I recommend that are easy to use and that you can just get the content done and you're out of it. But here are some meeting software. Most of you know, you're on Zoom now, so you understand that one, Skype, all that good stuff. Mobile app graphic creators. If you do this stuff on your mobile phone, sometimes it's a lot easier. And I know for most of us, we are just in the moment utilizing our mobile phones. So here are a couple of apps you can use. Canva, Studio, Over, InShot. I love InShot. I should have put a star next to InShot. It's my favorite. We are best friends. And social media management tools, podcast hosting. You need a content production schedule. If you do not have a content production schedule, we need to talk directly after this because it's going to make your life so much easier. And then video shop clips in iMovie, Quip, and InShot are all for video editing. So like I said, if you want that ebook, we can talk about that afterwards. KPIs, you know, you'll get a lot of people that will talk to you about key performance indicators. What am I doing? I'm not time. Okay, I'm going to go ahead and go a little bit faster. Key performance indicators, you can't measure everything. So, like I said, I put out that video of me talking about if you don't feel a connection to your baby. How long did I put that out? Maybe 4 years ago. And I just got someone that said thank you a couple of months ago, right? And so you never know who's being reached with your content. You can't measure everything, but just know that your posts are making a difference. As long as you're posting useful content, positive content, it is making a difference. But some of your KPIs, of course, engagement and reach, leads, and conversions, and that's going to be different for each of us depending on where we are. So HIPAA and social media. Like I said, we're going to go really quick over this. Patient privacy regulations, you should know some of that. Moderate your comments, huge one, right? Moderate the comments that are being made. If you're not utilizing a social media management tool, I highly recommend at least turning on your notifications and having the app on your phone. Now, that does run into a bit of a complicated situation. However, what you can do as well is you can utilize the Facebook app and just make sure you log out of it when you're not using it and log back into it because you have your login information. So that's how you can keep it secure. If you're like me and your kids take your phone, then you need to just lock it down, log out of it, and then when you're utilizing it, log back into it and make sure you're checking it often. And then social media post records. Hopefully you guys have a place where you're depositing all of your social media posts and you're keeping all of that information together. If you're utilizing Dropbox, which I don't have that list on here, but I'll tell you, Dropbox, you can utilize Google Docs or Google Drive, excuse me. There's a couple of other ones that I can't think of. Oh, Asana. You can utilize Slack to try to keep your team management together and deposit all of your content. But you should have one central place where all of your posts are going. So at any time you need to pull that back up, you can do so. All right. So how to talk to Black mothers, cultivating relationships. This is our bonus. So Black mothers, studies show that Black moms of color, or mothers of color, I should say, suffer from postpartum depression at a rate of 38%. I don't know why that's right now. At a rate of 38% compared to 13 and 19% of all moms, right? I'm one of them. So, I mean, I don't think anything else needs to be said about that. Cultural dictums often place women of color in the role of being all suffering for the sake of their communities' survival at the expense of themselves. So I can't rest because everyone needs me. I have to save everyone. This is what I thought. I thought this to myself. I can't rest. I can't take a moment off. I can't do anything because I need to take care of everybody. Everybody needs me. And so I allowed my own self-care to diminish. And I didn't take care of myself at all. I don't have that picture up here, but I looked a mess. You just put it like that. Meet Monique. So this is Monique. She's a mother of 7 and she's lost 4 children. This is actually from a Sacramento Bee article about the child health or child death rates. Hi, Marcia, do you have a question? Okay, you just came on camera. Okay, cool. So Monique's situation is my situation. That is where I was in that time. I have not myself lost any children. However, I definitely experienced high levels of stress, massive stress is what I like to call it, violence, death rates in the Black community, as far as my friends losing children, things to that effect, all of that, experienced it all. So when we think about Monique, I want you guys to just keep her at the front of your mind as we go on forward, talking about how to talk to Black mothers. So understand the signs of massive stress: anger, blame, and stigma. These are signs of massive stress. I know some people will say like sadness or mood, but let me tell you right now, anger, blame, irritation, those are all signs of massive stress in Black women. And so if you've dealt with Black women in person, and you may have encountered a woman who may have had a trail of kids with her, maybe 1 or 2 kids or what have you, and they're like screaming and she's like yelling, massive, there's stuff going on, as you can well see, right? But understand that if she comes at you, or if there is an encounter, it's not you, right? There needs to be a conversation that needs to happen beforehand. So I'm gonna leave that at that, because that would take way longer than I have to explain. But she's everyday perceived racism. I can tell you, if you think about what's going on for her, social media will tell you what's going on. I mean, you can do a quick search of hashtag Black moms, and you can see a whole list, a whole host of comments and stories of what's going on. But everyday perceived racism, she's experiencing in social settings, gas stations, grocery stores, banks, every place that she goes, she's experiencing people treating her differently, acting as though she doesn't know either what she's talking about or what she's doing, like she's not smart, so on and so forth. So perceived racism is definitely a thing. So now how do we talk to mothers? If they're on high alert, right? If these mothers are on high alert, they are trying to protect themselves and their children, they are doing everything that they can to just keep going every single day. How do we talk to them? So number one is to show interest in the African-American mother as well, right? Oftentimes, especially when women have babies, and this is women across the board, not just African-American women, the baby is the central focus. Oh, your baby's so cute. Oh, your baby's so healthy. Oh, your baby is running down, tearing up everything in the store, right? No one is going, hey, how are you? Are you okay? The person that actually gave birth to this little person, right? So really focus in on the mother and ask her how she's doing, and genuinely ask how she's doing. Because you might get the brush off of, oh, I'm fine, oh, I'm okay. But really dive a little bit deeper and ask and, inquire a bit further. Compliment. I cannot stress complimenting enough, right? I love your hair. You have a beautiful dress on. If you're, this was for healthcare providers, so I kind of repurposed this a little bit. If you're, giving shots to a child and you can say, shots are all done, nice job, mom, and give the mom a high five. Those different ways that you can really incorporate. The mom is doing great. They're alive, they're well fed, they look awesome, she's here, you're doing a fine job, let's keep this going. How can we, support you more? And how can we give you a compliment for everything that you do? So Mark Twain said this, I can live 2 months on a good compliment. And I think that's true. Being a woman myself, I must say, there's nothing like a good compliment. So number 3 is to ask a question, make her the expert. Really dive in deep, and this kind of goes into showing interest into the African-American mother, but asking her a question and making her the expert. We talked a little bit about before about having a community member speak up and answer questions about what's going on in the neighborhood and what's going on in the community, all that good stuff. Asking questions are so important, and you wouldn't think, that off the top of your head, you would go, okay, it's just a question, but really giving them a chance to have some say-so in something, it's amazing, because now I get to tell you how I feel, and that opens up the dialogue into bigger and better things, right? So creating a post for Monique, like I said before, keeping Monique in mind, we have to build know, like, and trust with her. She can't trust us if she doesn't know you. She can't trust you if she doesn't know you, is what I put there. So having podcasts, blog posts, right? I have a typewriter there, but you guys get what I'm saying. Blog posts, video, having that continuous connection with her through your content is really how we're going to build that know, like, and trust and create posts for Monique. Monique needs to you have to speak specifically to Monique, because as we said, we need to know what's going on with Monique. We need to know she's going through massive amounts of stress. And that kind of moves into this next one, right? We need to know her stress response is anger and irritability. We need to know her stress response is the superwoman theory. Oh, I got it. Everything's fine. I have it. It's good. I have everything. But really, do you, right? Really, in the back of her mind, she doesn't. She needs help, but she cannot ask for help because of the stigma that goes on in the community. And looking at the stress response of denial and blaming others, right? Looking at those key factors and knowing, okay, there's something going on here. How do I break this barrier down so we can build a relationship and move forward? So here I am. My 5 key focus areas are health equity, public awareness, provider training, right? Policy and advocacy, access to information, awareness of hope via woke delivery. So woke delivery is my baby, and that is my baby right there that I created. It's really about utilizing digital media to reach more moms, to reach more healthcare providers, and provide them with the information so that they know what to do. As I explained earlier on in the presentation, I was at a point in my life where I didn't know what to do, and I didn't want anyone else to feel that way. And so since we couldn't get women to come out physically, I wanted to go where they were and reach them in their pockets, which is with their cell phones, and give them the information on what they should do next. So with healthcare providers and support givers, because you all are support givers or healthcare providers in some way, shape, or form, deliver woke care, mothers heal, and babies live happy, healthy lives. So like we said, compliment, big one, find something nice to say to her or about her, ask a question and make her an expert, and know what's going on in your community. Stay up to date on music, news, and community. I think one piece that kind of sticks out to me, or that we miss a lot, is music. Music will tell you everything that's happening in your community right now. And listening to some of those songs, you're gonna wanna plug your ears up and go, oh my goodness gracious. However, it will give you some insight into what is going on in your community, because there are local artists that will tell you exactly, because that's all a lot of hip hop. It really is just storytelling. And so they'll give you exactly what's going on. So what we do, so here at Just Speaks Digital with the Woke Delivery Program, we do social media management, digital media, content creation, consulting, and training. What we do, no one else can do, because I have lived through it. So since I've been on the other side of this, I know what content needs to go out there to make sure that moms respond to it, as well as what healthcare providers need to know so that they can help more mothers. When I started this, I wanted to talk specifically to mothers, but I got pulled into the realms of actually helping healthcare providers. And I was a little upset about that, right? I was like, no, I want to help moms. I want to help people like me. And then I thought about it, oh, wait, but if I help you all, you guys are going to reach mothers where I can't reach them. So I am, in essence, helping mothers. I don't have direct contact with them, but I'm helping them through you all. So I want to thank you all for coming on this webinar and listening to me chat and run over my sentences and all that good stuff, because this is really important to me, and it's important to our community as a whole. All of our mothers are out there and they need you all. So thank you so much for allowing me to speak to you all and provide you with this information. This is how you can get in touch with me. If you would like a full social media analysis, really a digital media analysis, you can schedule a complimentary one by going to this website, or you can email me. Here's my phone number. And now we're going to move into Q&A. I will send you guys a poll. Really, it's going to be a questionnaire, more of a questionnaire than a poll. But I am here to answer any questions that you may have in our last couple of minutes here.